Hi, Ms. Drinkwine.
Hello.
My name's Logan. I'll be your physical therapist today.
All right.
So today, I know you came in, said you have some leg pain here. So what we're going to be doing is I'm going to ask you a couple questions. We're going to go over some forms that we had you fill out in the waiting room. And then after we go through all that, I'm going to do a couple different tests on your leg, see what I'm feeling from your leg. And it shouldn't take any more than maybe 45 minutes or an hour, and we'll get you on your way. Thanks for coming in.
All right.
So, I know you are Helga Drinkwine.
Yep.
What is your age?
I'm 24.
You're 24. Perfect. What do you do for a living, Helga?
I'm actually a dancer at SeaWorld. I dress up as a chipmunk. I'm Punky the Plucky Chipmunk. And so I have to dress up in this big chipmunk costume with the big cheeks and everything, and dance around in it all day, say hi to little kids and stuff.
Okay, it's pretty involved then.
I'm always up and about.
Yeah, not too much sitting goes on in that.
No.
Okay. How many hours a week do you typically work?
40-hour week, just regular.
Okay. So outside of dancing, are there any hobbies that you partake in? Do you have an exercise program, anything like that?
8 months ago or so, I started a running program that I really, really like. I've been pretty consistent with it.
Awesome.
Until recently, until I hurt myself. So.
Well, hopefully we can get you back into that running program.
Yeah.
It's awesome that you've been sticking with it. It's good.
Yeah.
So, dances, runs. Do you have any other hobbies or things you like to do for fun socially?
I just go out with my friends a couple nights a week. Just for happy hour here and there. But
okay.
Yeah, I like to garden too sometimes. That's actually how I hurt myself. So.
Well, hopefully we can get you back to gardening too, and we'll try and prevent the next gardening-related injury.
Okay.
For sure. All right, so you obviously came in with some leg pain. Do you mind standing up for me and kind of showing me where your leg pain is?
Sure. So it's starts right here, and then it goes all the way down, just basically to the back of my knee.
Basically to the back of your knee? Okay.
Yeah.
So I'm going to use my pinky and kind of point. So it doesn't go anywhere down here into the foot, anything?
No.
Okay, and it doesn't run up into the buttock or low back area?
No.
So pretty much just this back side of the leg right here?
Yeah, back right there.
Okay, does it come over onto the front side at all?
No.
No? Okay, does it come onto the right leg at all?
No. Sometimes my right leg just gets a little sore, but that's just because I'm standing on it so
Standing
much.
on it more? Okay, you can go ahead and sit back down.
Okay.
So, no pain anywhere below the knee, no pain in the other leg. Do you have any pain in your abdomen by chance, chest, shoulders?
No.
Just that leg?
Yeah, just the leg.
Okay. All right. How would you describe that pain that you're having?
Well, usually it's kind of achy, and when I straighten out my leg, it hurts a little bit more. But I wouldn't say it's unbearable.
Not unbearable. Okay. So right now, on a scale of 0 to 10, how would you rate that leg pain?
I think it's about like a 1.
1. Okay. When it's at its absolute worst, how would you rate it? Same scale, 0 to 10.
Okay. Maybe like a 6.
6. Okay. And then at its absolute best, 0 to 10.
0 pain.
0.
Yeah.
Well, that's our goal, is to get you to that 0 pain, keep you at that 0 pain. So
yeah, I like that.
Definitely. So you already kind of said straightening your leg out brings about that leg pain. Are there any other things that kind of make your leg hurt?
Like walking around for even just if it's a couple minutes, it starts to hurt.
Okay.
And dancing kind of goes along with that. That makes my leg hurt too.
Okay. So with the dancing, you said walking was a couple minutes. Dancing, is it still a couple minutes? Is it sooner or later?
If the walking is like 2 minutes, the dancing would be like a minute because, it's more like vigorous activity.
Definitely, for sure. Now, after you've kind of got it to flare up from walking or dancing, what kind of makes the pain go away?
Usually I'll just sit down or lay down and rest it, and icing it actually helps.
Okay.
And my doctor prescribed me a medicine called Mobic.
Okay.
And I'll take that, and maybe like 30 minutes later it'll feel better.
Okay. So with the Mobic, it takes about 30 minutes. Do you ever not take the Mobic and get it to go away?
Not completely. Just the rest and ice helps it, but the Mobic makes the pain completely go away.
Okay. So the Mobic gets you all the way out of it.
Yeah.
Okay, so how's your pain in the morning?
In the morning, I wake up and my leg's kind of stiff. I have to get it kind of warmed up before I can start walking.
So more of a stiff feeling, not so much of a pain feeling?
Yeah, I mean, it's just low pain in the morning,
Okay.
but it's really stiff and kind of hard to move.
So then throughout your day, whether work or, even at the house, how's your leg feel?
So I guess throughout the day, since I'm walking so much and doing more activity, it starts to hurt a little bit more. And then if it ever gets up to that 6, every once in a while it does, I'll sit down and take a break
Okay.
and rest it.
So then once you get home for the evening, how's your leg do?
It's okay. Once I get home directly after work, it's sore, so I'll sit down and rest it and ice it. Maybe take a Mobic if it's feeling really bad.
Okay.
And then once I do that, it'll, kind of go away a little bit.
So with that, kind of take the Mobic, gets the pain to go away at night. Are you able to sleep? Does your pain affect your sleep at all? Does it keep you up? Does it wake you up?
No, I'm sleeping through the night just fine.
That's great to hear, actually. Okay, so now we're going to kind of go over some of those forms that I had you filling out in the waiting room earlier. I noticed that it has a previous surgery on here, on your hip. Do you know anything else about that?
Yeah, that was on my other hip, so I guess on the right side. They said I tore something when I was a cheerleader in high school. I was 18, so that was like 6 years ago. So.
Okay. And then you also mentioned that you've had some anxiety in the past. Do you still currently deal with that? Are you seeing a doctor for it, or?
I'm not really seeing a doctor for it right now, but I do get a little anxious. I'm pretty scared of physical therapy. My friend had a bad experience with it, so I don't want to get more injured because of it.
No, yeah, that's definitely understandable. I'm sorry to hear that about your friend also, but yeah, our goal is definitely to get you kind of out of that pain. We don't want to make anything worse, so I can assure you that we're going to do everything in our power to keep you out of pain and make sure that you have a good experience with us.
Thank you.
All right. So did your doctor order any images for your leg, x-ray, MRI maybe?
Yeah, actually, I had an x-ray and an MRI, and they told me it was kind of like a hamstring pull or something. I'm not too sure what it means though.
Okay. So generally what they mean by that is your muscles are meant to stretch and then kind of go back to where they were, but a pull is what they call it, is basically means your muscle kind of got stretched a little too quick and there might be a little damage, but as long as it's not, if they didn't tell you it was torn, you should be in good hands. Okay, and we should be able to get you fixed up. They didn't tell me that. Okay, you definitely should be able to get you fixed up sooner rather than later, for sure.
Good.
Now you mentioned the Mobic. Are you on any other medications by chance?
No, I used to take something for my anxiety, but I don't take it anymore.
Was that something that the doctor just had you stop taking, or is that you just stopped taking it?
I guess my doctor said if I was feeling better, I could kind of ease off of it, so.
Okay, so he kind of told you to use it as needed then?
Yeah.
Okay. All right. Is there a particular way that you prefer to be taught things?
What do you mean?
So do you learn best by me simply explaining things to you with words? Do you learn best if I give you pictures? Would you rather me demonstrate? Would you rather do something?
Yeah, so I like, it would be helpful if you could demonstrate something and kind of tell me what you're doing at the same time, and then I'll do it, and then you can, I guess, tell me if I'm doing it wrong or not.
Definitely learn by doing then, and seeing and hands-on.
Yeah, hands-on for sure.
I know you said that your friend had a poor experience with PT, and that was kind of a little fear for you. Is there anything else that you think might get in the way of you having a positive experience with this here?
No, my friend really didn't like PT, and so it's kind of making me uneasy. I'm kind of freaked out about, doing all the exercises and stuff.
Yeah, that's understandable, but again, like I said, we're going to try and keep you away and out of as much pain as possible and make you better rather than worse.
Thank you.
So, when did this initial hamstring happen? When did you start noticing this pain?
Well, actually, funny story. I was trying to hang a like a pot of flowers up on the ceiling on my porch, and I didn't have a ladder, so I decided that I should stand on one of my other pots, and it was like 3 feet tall. And I kind of lost my balance because I was trying to reach over here to hang it, but the pot I was standing on was more to the side. And so I lost my balance, and then I tried to step off of it, but my dog was right there. And so I had to like kind of move out of the way of my dog because it's little and I didn't want to crush it. And then so what happened was I like landed on my heel like this with my knee all straightened out and my toes up, and that's just when I started feeling the pain.
Okay. Definitely don't want to hit the dog though. I get that. I'm a dog lover myself, so I can understand avoiding the dog. But yeah, definitely don't. I don't recommend using the flower pot as a ladder anymore.
Yeah, I think I'll go out and buy one.
Yeah. So, have you ever felt any pain in that backside of your leg before?
No, never. I've
Never?
always been okay.
Okay. Perfect. What is it that you would like to get out of this physical therapy, or what would you like to get back to through physical therapy?
Well, I really want to get back to dancing. I really love being Punky the Plucky Chipmunk. Gotta stay plucky. But yeah, just that and hanging out with my friends. So, and obviously getting back to my running.
For sure. Well, hopefully we'll be able to get you back being Punky the Plucky Chipmunk. It's a tongue twister for sure. Hopefully we'll get you back to being Punky the Plucky Chipmunk sooner rather than later. And you can start that running program and all will be back to normal and you can go participate in happy hour with your friends.
Yeah.
So when you go to happy hour, you guys have a couple drinks?
Yeah, just a couple, maybe like once or twice a week. But I never have more than 4 drinks a week, so.
Okay. Not too bad. All right, well, I think that wraps up this part of our evaluation. So we're going to get to me doing a couple things on your leg, testing some strength, how it moves, and yeah, we'll just go from there.
Okay, awesome.